Hi team, I'm here today to talk to you about our new electronic health record that we are implementing in the next couple of weeks. I want to get you all on board with this new program that we are going to have. It's going to be great for the hospital. It's going to improve communication between our providers and our patients. And it's going to make overall charting and documentation practices easier for you, I hope. Let me talk to you a little bit about what things that this program is going to offer us. First of all, with this new program, we are going to have the ability to have fantastic administrative processes. This is going to include the availability of easy coding and billing for our patients. We're going to be able to manage their insurance payments, their insurance cards, if they have multiple insurance providers. Everything's going to be in one system. It's going to be easily tracked and accounted for once we need to do that for the billing process. And it's also going to be a great way for us to keep track of things that are being misbilled and underbilled so that we have better financial responsibility to the hospital and our patients. Another thing is going to be the ability of databases so that you are going to have at your fingertips more resources that you'll be able to reach into when you're trying to make a difficult diagnosis for a patient that you're unsure of whether they could have one disease or another, and it presents as both. This will give you a way to research and see if you can come up with a better way to diagnose specifically what is wrong with this patient. It is also going to make it easy for us to keep track of screenings and preventions that our patients need on an individual basis. It will alert us what is due at certain times in that patient's life. For instance, if you're working with a newborn, it will pop up when that newborn is due for immunizations, and it will let us know if that immunization is past due. Pardon me. It's also going to make it so it's easy for us to track our patients' allergies, both environmental allergies and medical allergies, so we are not making a mistake and risking a patient's life by giving them something that they do not need to be taking because they're allergic to it. We will also be able to track more of their health information and data. This is going to link us to other providers in our network so that as long as the patient agrees and signs the paper that they are okay with us sharing this information with the other providers, every time a provider in our network opens that patient's portal, they're going to see what they've been diagnosed with. They're going to have access to what medications they're on, so they're not being prescribed multiple medications for the same disorder or contradicting medications for different disorders. And this will help prevent medical prescription errors that can risk the patient's health and life. This is also going to be where we're going to be able to look at this patient's record, and we're going to see where they live, how old they are, any problems they've had in the past. If we are working with transgender patients, it will allow us to see that they are transgender and what they prefer to be known as. This way we are speaking to our patients as they wish to be spoken to and acknowledging them as the person they are. This is important because we do not want to alienate any of our patients. We want all of our patients to feel very cared for and very included in all of our processes. On top of that, this is also going to give us a new opportunity to communicate and have connectivity with our patients. Along with this database that we're going to have in place in our hospital and our providers' offices is going to be a patient portal that the patient can access. This portal is going to give them the basics of their diagnoses. There's going to have a list of the medications we have prescribed. They will have access to their after visit summaries at the tip of their fingertips. Hopefully this is going to improve the care that the patient is getting. And they will be more informed of what they need to do to keep themselves healthy. And they will be able to contact us through this patient portal via an email. They will be able to contact us with non-urgent messages. They will be able to contact us with urgent messages. They'll just have to hit a drop down and choose which it is so that they get a response in a timely manner. They are also going to be able to view their test results. We know in the past that patient portals and viewing test results can be anxiety ridden for our patients. So we are going to make sure that we are contacting our patients as soon as we get a lab result so that they don't read something on their patient portal and get concerned about it without knowing that we are on top of it and we are contacting them to tell them what the next step is if it is a bad test result or a questionable test result. It's also going to be able to keep track of they'll be able to go in there and they'll be able to look and see when their appointments are, where their appointments are, what they need to do prior to their appointments, and they'll even be able to schedule appointments with their providers through this new electronic health record. On top of all of that, we are also going to integrate dentistry and optometrist visits into our electronic health records. As many of you know, some diseases clinically present as dental issues or a patient has problems with certain issues with their eyes. This can lead us to make diagnoses of diabetes and high blood pressure and other sorts of things. It is imperative that we know that these patients are having these problems with their teeth or their eyes so that we can make an attempt to get them diagnosed if their problems are leaning towards having one of these other medical problems. As you know, dental health can play a huge role in the rest of the health of your body. So we want to make sure we're staying on top of it. And with this new electronic health record, having that dental and vision component in it, we are going to be able to see, oh, this patient's been having some problems with their eyesight recently that they haven't made before. This goes in line with possible diabetes, blah, blah, blah. We're going to be able to track that and say, let's get this patient checked out for this, this, and this. And the last thing I want to talk to you about is the fact that this new electronic health record has this order entry management system in it. And with this system, we're going to be able to place orders through this system even without seeing our patient. If our patient calls us via telehealth or reaches out to us in the email and we feel the need to get an x-ray, an ultrasound, or something of that type, we're going to be able to enter this into this electronic health record, and it's going to go to the provider that they need to go see so they don't have to have the physical paper in their hand saying, hey, I need this x-ray, here's the paper. They can walk into the center and they will be able to, people at the receptionist at the center is going to be able to pull it up and say, okay, you're here for your ultrasound. Have a seat, we'll get right with you. They're also going to be able to prescribe medications this way, as we know that medications have taken on electronic prescribing recently, and it's beneficial for the patient because they don't have to worry about losing that script once again, and will have it in their hand to do it. They won't have to have it in their hand to take to the pharmacy. The prescription is going to automatically go to the pharmacy, and the patient can just go pick it up at their convenience. On top of all these other great things that this electronic health record is going to offer us is also a way to track population health. If we notice that a lot of our patients are coming in with the same symptoms and same diagnosis, and it points towards a disease that is communicable in the community, then this electronic health record program is going to highlight that. It's going to alert us to the fact that, hey, you have something going on in your community that you guys need to really look at, and you need to get maybe your health department or the CDC involved in. It's going to alert us so that we are not missing an outbreak if it possibly happens. This electronic health record is very costly, but it is also going to be very beneficial for our hospital and for the health of our patients. I hope you all agree with me, and I look forward to getting you all trained in this new electronic health records that we are using, and hope you enjoyed it as much as I do. Thank you.